In Tennessee, we realize that there are a lot of, there's a lot of healthcare data that we look at that is concerning in terms of making sure that there is quality healthcare and access to healthcare for all of our communities. I see what the repercussions are when you don't have adequate healthcare. And so we're not only training graduates and healthcare professionals, but we're trying to shape what the healthcare landscape looks like across the nation. And in Tennessee, we've been in this state for quite a while, and we've had over 3,000 graduates in this space. And taking a look at what environments and communities they're graduating in and working in for the rest of their careers is really important for us to just understand how can we make a better impact and meet the workforce demands in this space. At WGU, we're very workforce aligned. At the end of the day, we are very focused on making sure that our students have a great pathway, but their quality of life and their career kind of trajectory and balance of work life is very much also dependent on what the healthcare landscape looks like.
Everybody has a shortage, and there's so many of the primary care fields, whether it be family practice, internal medicine, pediatrics, OBGYN, general surgery, there's a shortage on that. Psychiatry, obviously, there's a shortage on those things. Anyone who can practice in those fields are crucial for rural communities, or even in urban areas as well. We find that if people are willing to work in rural communities in particular, and they wind up training in their residency for a physician in a particular area, their 80% is likely to stay in that area within an 80-mile radius of that. So we've created a lot of programs and funded a lot of stipends to get providers to be able to take on students or residents, and nurses to be able to take on other nurses, to educate them and get them exposed to those areas. And then if just one or two of them like it, they may stick around and come back and practice there.
In Metro Nashville, we are not in a local healthcare desert. There's an abundance of healthcare in Metro Nashville. There are a lot of rural and surrounding areas that do not have the same access to healthcare, and that's a challenge in Tennessee. Post-COVID, we lost a lot of clinicians across the board, and we're still recovering from all these areas, and the needs of the community have not gone down. I think the goal is sharing information and connecting with colleagues so that we can come up with positive solutions to some of these things. And I think right now we're kind of in a bit of crisis. There's been a lot of funding challenges with respect to rapid changes happening very quickly. And some of this is just commiseration that we're all kind of struggling together right now, but none of us are alone, so we can continue the fight.
We have some of the best healthcare in the nation here. We have the ability to take care of very advanced diseases, but we just, it's not getting out to the entire state. And so if there were a way to divert more resources to our needs, that would be awesome. Now, there are ways to overcome that, like telemedicine. Let's bring the technology to you and allow you to live wherever you want to live. But we would also need some cooperation from those folks in rural areas to do whatever they needed to do to come closer to where the healthcare is. 10 years from now, we're going to have a major shortage in physicians. We know that. We do have the 5th highest mortality rate. I'm just trying to be sensitive to all the dynamics and the complexity of everybody coming together and saying, okay, what are we going to do to allow us to have better health care in this state?
The unique position that Western Governors University is in when we're kind of looking at how can we help in communities that maybe have a large rural population or really have these health disparities that are really localized to specific areas. Our competency-based model allows us to bring our program anywhere that a student has a laptop. And even if technology isn't great, we also have ways to help our students navigate that, to be able to learn within their community. So the interesting thing for us is that we do have our pre-licensure nursing program. This is one of our programs that creates net new nurses. And with this program, this is really what you're gonna need to help contribute to fixing the nursing workforce shortage. I don't think it's the only fix in that, but it really is one that's going to drive net new nurses and the creation of those net new nurses. And with that, one of the concerns we always see, and somewhere you can really see this is in Tennessee, is that if you can't be educated, especially in a profession like nursing, where you live, you can't be educated rurally. You have to leave to get that education. The odds of you going back to your rural community diminish. And by allowing us, or us having that opportunity really to come into your home and to provide that education in your community for the majority of your pre-licensure nursing program, to do your clinicals where available in those healthcare facilities that desperately need you to stay to keep the doors open, we're able to then change the narrative and now move that education, move that training to these rural communities so you become more competent, more practice ready for us with our immersive model, and really being able to bring the education to where the student lives.